Welcome to another exciting episode of BoardTalks, where C-level personalities from various companies in various sectors talk in depth about the most relevant and up-to-date information on the future of health and technology. I'm your host, Diogo Sousa-Martins, founder and president of ELS Group. And in this episode, we'll explore the evolution of medical cannabis in Portugal. By 2028, the global medical cannabis market is projected to reach around $14 billion, and Portugal is playing a crucial role in this growth. The country has established itself as the largest cannabis exporter in Europe and the second largest worldwide, surpassed only by Canada. But how has Portugal become such a key player in the cannabis landscape, and what is its evolution towards medical cannabis? While Portugal has historical ties to cannabis through its colonial era and overseas territories, particularly in India and Brazil, the modern era of medical cannabis in the country began more recently. Portugal took its first step towards facilitating discussions on medical cannabis in 2001 by decriminalizing all drugs, followed by the legalization of its medical use in 2018 under strict regulatory frameworks showing significant progress. To explore this evolution of the field, I'm pleased to be joined by Dr. Carla Dias, the president of the Portuguese Observatory for Medical Cannabis, which is a very important association that has had a very significant role in informing and educating about the benefits and use of the cannabis plant for therapeutical purposes. So thank you very much for coming and joining us, Dr. Carla. It's a pleasure, and welcome to our episode.
Thank you.
Dr. Carla, as the president of the Portuguese Observatory for Medical Cannabis, I cannot resist to ask you what inspired you to take on this role and become a leading advocate for medical cannabis in Portugal.
Okay, so I am the president of this association. I don't have anything to do with health, I have to say. So I'm here just because, mainly because of what happened to my daughter. And she started because she has an refractory epilepsy, and she started to use cannabis to control her seizures, and that's why we joined with other people to mark or to make pressure in the government to make the law get out of the paper, for that to say. And with that, we are trying to give the patients what they deserve, which is to have medical cannabis available in pharmacies, as the law always establishes for that.
That's great, and it's the best reasons is when we have a personal inspiration as well. And thank you as well for being a leader on this field in making also the law more applicable to more patients worldwide. And I think that's a little bit of our role as well. So it's truly inspiring, and being at the forefront of medical cannabis and following its evolution. And speaking of evolution, since you are deeply involved in the developments within the sector, how do you think Portugal's role within the European medical cannabis market evolved since the legalization in 2018, particularly considering the country becoming the second largest exporter globally in 2024?
Okay, so Portugal, since 2019, as we have the law at that time, has had a rapid transformation or evolution in medical cannabis sector. Although we are not interested directly in the increase of exportation, so our aim is to help patients So, in fact, there are many companies licensed in Portugal by our legal and government entity, which is the Informed. And because of that, we also have a grow or an evolution of products, which is good. Of course, we know that the companies, we know that they have to survive and they have to export. And we have 37 companies so far that are licensed at the moment. And that is good for many reasons. Of course, it's good to have this evolution in medical cannabis.
And I fully agree that Informed has played a pivotal role in making access a reality, because if it was not by the good scientific scrutiny and regulatory scrutiny or quality assurance scrutiny of Informed, we wouldn't have so much quality products as well being produced and exported from Portugal. What do you think are the main factors driving this rapid expansion, and how do you see this shaping the future of the industry in Portugal?
Okay, so this evolution, this growth, is mainly due to a regulatory environment. So it was created a set of rules and regulations that already exist in other countries, and we have also. And these regulations are one of the major causes of this growth. The other one is the one that we know. Portugal is known for being a very known country for its climate. So, of course, the climate conditions are indeed a cause for this. And the position of Portugal in the world is also a point which is very important, is excellent to export. And because from this point they go to another country, so the exportation is also due, the growth is also due because of the strategic geographic position, of course.
Sure. Mm-hmm. And what would you believe as being the OPCM role, the Observatory of Medical Cannabis in Portugal, the role of bridging the gap between access to more Portuguese patients that are in need of this medical cannabis?
In fact, we have also observed a rapid growth in the preparations and substances according to the law. So we have now 12 medications which are approved, and since 2019. And we have the pandemic times, which slowed down a little bit, but 12 preparations, it's a very good number, I think, comparing to other countries. Of course, we can say it's not enough, but when we compare to 2021, we only had one preparation, and we still continued with one preparation for 2 years. So to have 12 at this moment, I think it's remarkable, because our doctors, our physicians, they can prescribe, and they are available on pharmacies. And another thing which is very important is that the preparations and substances, they are with the different ways of absorption, which is they have other means of taking, the patients have other means of taking this, not only to evaporate, but is also we have also a solution which is good for palliative care and so on. and we have different concentrations of cannabinoids. So there are so many pathologies that we can, or that the physicians can prescribe. And this is, as I said, a remarkable step that will help indeed the patients mainly.
Yeah, which goes directly throughout also the mission of your observatory, in which by also a coincidence we have its, I believe, fourth conference in the upcoming month. Is correct?
Yes. So one of our missions is to provide knowledge to the physicians, to the pharmacists, to the nurses, because they will help at the end of the line. They will help the patients. And this education, this learning, this knowledge, although it's in the law, it is not being done by the government. And our doctors, they don't have the knowledge because this is not taught at universities, as you know, and very new. It's new in other countries, and it's new for them also here in Portugal. And we decided that so those are the main health professionals that are going to help the patients. So we need to give them the tools to help their patients. And this is the fourth conference that we are doing. And we have many participants there, health professionals and students from the university, because we are in the campus, the university campus. We have normally speakers, national speakers, but we also have international ones that come to our conference and can share their experience, can share their studies and reports and clinical trials and so on that they are doing, and provide our physicians the means and the knowledge to help our patients. So I think that sharing this knowledge and experience is indeed the most important thing that we can do for patients.
And I think it's a very, I would say, blunt and courageous move, because a lot of people have a lot of stigma about cannabis, because by being, let's say, having the track record of being a drug used for recreational purposes, sometimes people underestimate the power of the substance. And the fact is that most of drugs and medicines are there for centuries. And depending on the dosage, on the type of product, we can have a beneficial use of them as well for other type of patients to use as a medical, in their medical arsenal. So thank you as well for coordinating this conference, the fourth Portuguese Medical Cannabis Conference, organized by your observatory. And we are almost closing, but just wanted to ask you a final short question to you, is that even knowing that the conference is going to exist, what do you think will be more or less discussed, how in terms of the evolution of the industry, not only in Portugal, but also outside, what would you think would be the key themes that will be addressed on that conference?
This year we are doing something a little bit different. We are going to start the morning with two main topics that are going to divide in the afternoon. Be divided in the afternoon. So we are going to start by guidelines to prescription. So we have a doctor, which is Janos Kratz from Germany, that is going to share his experience and also talk about the endocannabinoid system and so on, but mainly to share his experience as a doctor in dosage, in the types of cannabinoids and dosage and many things that he can share with the other physicians according to the different pathologies that he is treating his patients. And then on the other side, because we lack of evidence, and the physicians are always talking about the lack of evidence that we have. And we decided to have a specific topic, which is research, scientific research. And for that we have one of the major and one of the biggest and known investigators, which is David Mary from Israel. And he is coming to talk about his investigation in Technion, his university, and where he has a joint group, and he studies many of this and many things related to cancer and so on, sleep disorders, and he is going to show how he does this investigation and the results of that, which is very good for our investigators. So this is new also because we, besides physicians and pharmacists, we will have also researchers in the conference that can get some knowledge from him. And we also have our Portuguese physicians who are already prescribing those 12 medications that we have approved, and they are going to share their experience with those preparations and substance in Portugal. So I think it's more like a workshop, but not a workshop because we will have many people. And as you know, it's around 350 more or less. So we cannot have a workshop, a closed one with a few. So it will be a larger workshop. That's why it will be different from the other conferences that we have in the past. And I think at the end, our participants will be more available to help those that they have daily in their appointments at the hospitals and so on.
So to our spectators and people that are watching us, please stay tuned for the 4th Portuguese Medical Cannabis Conference. Go online to the OPCM webpage and join as well. The conference is going to be very educative and for sure will be the forefront of all cannabis, medical cannabis science there. So thank you very much, Dr. Carla, for sharing your insights into the evolution of the medical cannabis in Portugal and steps ahead. The country is making really a significant progress thanks to the Ministry of Health, Infarmed, and also organizations such as yours. And your work with OPCM is pivotal in shaping the future and addressing the gaps that will help Portugal, as other countries as well, in excelling in this sector. We look forward to seeing you at the 4th Portuguese Medical Cannabis Conference, which I'm sure will help further advance the industry. And to our audience, thank you for tuning in, and I'll hope you join us on the next episode of BoardTalks. See you there.